Okay, so kind of talking about med ethics and med law. So med ethics and med law are just topics that you'll see all throughout medicine. Like you'll see it from probably the first year you go into the last year you come out. And you'll have ongoing tutorials, even in the clinical years, to kind of remind you of these principles. And you'll likely have to kind of discuss different viewpoints that talk you'll in these tutes or in these classes, the goal is to kind of debate different points and consider different aspects of things. So you'll also see a lot of medical lawyers or doctors with special interests in bioethics. And why that's useful is because you kind of get different perspectives from different people. That enables you to kind of learn a little bit better and understand the different considerations that go into making a medical decision or the different laws which surround patients to both protect them but also protect you as a medical professional. So we'll just talk a little bit about the principles of ethics first. So there are four main pillars of ethics, and you'll see this throughout your medical education, that the four main pillars are beneficence, non-maleficence, autonomy, and justice. Cool? Right. So when we talk about each of these, we mean different things. So I try to represent these using the pictures, and they're exactly what you can see in the picture. So let's talk about autonomy first. So autonomy is focused on people's choice, the people's right to choose their own paths. Okay, it's defined as the patient's right to be self-determining or act in accordance to their own reasons and values. And why that's important when we're talking about reasons and values is because essentially we want them to be acting according to their own thoughts. So often a scenario which comes up when we talk about autonomy is talking about a patient's ability to choose or refuse a medical treatment. And ultimately, because there is that principle of autonomy, according to ethics, by nature, if a patient chooses not to have something done to them and they're fully aware of all the consequences, but they feel like that's just not the suitable thing for them according to their values, then we have to respect their autonomy and focus on giving them what they want. But on the flip side, it also doesn't mean that we are just here just to provide things like if they say I want A, you give them A. If I want B, give them B. We also can we can choose to offer things or not offer things, but they can choose to accept or refuse, essentially. The second two principles are kind of tied together. So they are the principles of beneficence and non-maleficence. So they kind of sound like a bit like tongue twisters, but essentially all they mean is beneficence is focused on kind of trying to benefit others, right? So we need to act in the patient's best interests and we need to act on the behalf of the patient and what we believe would be in their best interest. So if somebody was quite sick and in hospital and had an infection, we would think the best thing to do in that aspect would to be provide some medications for them because that would be in their best interest if especially if this person was young and fit and otherwise didn't really have any problems, we definitely would think, okay, they really can't make a decision for themselves because they've already fainted or are unconscious, and you think, okay, it's probably in their best kind of interest to do it this way. Non-maleficence is kind of that flip side to it, so it means doing no bad, and it conveys the obligation of do no harm. So that's a main thing in one of the principles of ethics. So the idea of we cannot do harm, and this is probably even more important than the principle of beneficence to not do harm, because a lot of things innately in medicine will have harm attached to them, like any medications you give, any procedures you do, anything really. Like there's gonna be a risk with anything done in medicine. So our goal is to limit the possibility of that risk occurring and limit the possibility of bad things occurring in the future, essentially. More specifically, obviously, we cannot be like guarding a patient off to try to get try to protect them from everything in the world, right? But the principle of non-maleficence is essentially just saying that we want to prevent any preventable harms, or we want to stop any preventable things from happening to this patient that we could have stopped, or that we could have kind of lessened the impact of. The last principle here is something called justice, and there's two components to this justice. There's something where we think of justice as the scale, so everybody needs to be treated with equality, and everybody needs to be treated, so regardless of their race, their age, their sexuality, their social status, their wealth, their religion, any factor in their life, essentially, except for their health status. And sometimes that can also not, that's also important not to discriminate against. But in most circumstances, their health status and kind of their their problems according to their health are the only things that we can really consider. We cannot talk about any social characteristics of a person as influencing us, whether we are going to give medications or not give medications, or whether we're going to help them or not. So that's the idea of justice. And then there's that kind of subcomponent of the idea of distributive justice. So distributive justice is focused on making sure people get equal share of what is being provided. So, for example, if you were going to the fridge and you just got an ice cream for yourself on such a hot day and you got nobody else an ice cream, I feel like people would be quite unhappy with you. So it's important that everybody got an ice cream because it equally, there might have been 10 ice creams in the fridge, and you said, okay, I can get one for each person. And as long as it was possible that there was enough resources, enough things to do that, then according to the principle of distributive justice, we need to make sure to give ice creams to everyone. Cool. Alright. So then we have the idea of informed consent. So these two concepts are probably the concepts which come up the most repetitively all throughout your medicine life. So I thought that they would be important to cover now, especially because they're assessed and you talk about them quite a lot. So, the idea of informed consent is done from day one and is super important for any healthcare related profession, whether you go into being a doctor, being a nurse, being a physiotherapist, being a pharmacist, being an allied health professional, being a dietitian. Like, it doesn't matter what career you go into, anything health related in life, in the healthcare sphere, will require informed consent. And the components of informed consent are three parts. So they must have capacity, it must be voluntary, and it must be informed. Okay? So let's start with the informed part because that's probably in the name. So, informed means that we must tell them enough information for them to be able to make a reasonable decision. So, they must be able to know why something is being done, what effect it will have with them, what risks it might be attached with, and what benefit they might reap out from it, and along with kind of the long term, like, is there anything else that could have been done to replace the thing that's being offered? Right? Voluntary is focused on being that it's free from influence from others or coercion, which is otherwise known as coercion. So you can have internal coercion, which means you are influencing yourselves, and that can occur when people have voices in their head or have things going on in their own body which are trying to force them from doing something, force them to do something. Sorry. And then we also have external coercion as well, which is when other people are trying to convince that person to do something. So often this can be unintentionally family members who are trying to just help along the patient in hospital, and unintentionally they've coerced them into doing something. The last component is capacity, and this is super important because capacity just basically equals to the ability to make the decision, right? For for in Australia, everybody above the age of 18 is considered that they have capacity automatically unless they prove otherwise. And then people under the age of 18 can do different things to kind of prove their capacity. So in order to be able to be competent enough to make a decision and be able to kind of use your use your thoughts and use your values and apply your values to making a decision, which is the principle of autonomy, you must have capacity. So the components of capacity, there's four components. You must be able to retain. So if I said to you now, what are we talking about? What's the importance of beneficence? And you and I tell you, okay, this is why it's important. You should be able to retain that. You should be able to understand that. So if there's any language barriers or anything of that similar nature, then they kind of fail the step to understand. The next step after that is to be able to weigh. So you've gotten all this conflicting information. You must say to yourself, okay, what do I think is better? What is better in the risk benefit ratio? And then the fourth part is be able to communicate. So you've weighed it and you say, okay, I want this. You need a method to be able to say, I do want this one, not that one. And that doesn't necessarily have to be verbal, it can be written down or anything like that as well.